Let's understand liver real quick. Liver is also known as heparin in Latin. Its external anatomy consists of two surfaces, the diaphragmatic surface and the inferior or the visceral surface. The diaphragmatic surface is the superior surface, the visceral surface is obvious, and inferior surface is obviously a inferior surface. Then it has two borders. The inferior border is thin, and the superior border is wider. It weighs about 1500 grams and is fixed to the diaphragm by two ligaments. Now, this is the coronary ligament. The liver attaches to the diaphragm by the coronary ligament. And coronary ligament, and on the each side it becomes a triangular structure like this. It is also known as triangular ligament. Then we have the if we say the liver is fixed to diaphragm by two ligaments, it is based on two planes. So on the frontal plane we have the coronary ligament, as you can see, and on the sagittal plane we have on the sagittal plane on the inferior border we have the falciform ligament. One right here. This is the falciform ligament. Then um, on the inferior border is the umbilical vein, which is obliterated after birth, and then this one obliterates after birth. First, it is known as the umbilical vein, but then after birth, it obliterates, and then after that, it is known as the round ligament or the ligament of teres. Then we have the falciform ligament. The falciform ligament is the so the falciform ligament divides the liver into the right lobe and the left lobe. Okay, the right lobe is in contact with esophagus. Then we have on the visceral surface, right here, right here, on the visceral surface. You can check out a liver diagram. That would be easier for you. Uh, so on the visceral surface, we have a green sac-like structure called the gallbladder. So parallel to the green sac or parallel to the gallbladder, it has a groove, okay, which is known as round ligament or uh, teres ligament. Round ligament or ligament of teres is present. Then, opposite to the gallbladder, opposite to the gallbladder, we have a groove of inferior vena cava, which is parallel, which parallelly has groove of ligamentum venosum. So, and the transverse groove called the porta hepatis. Now, this one right here, I'll explain it. So, this is your gallbladder. This is your round ligament. So this one is opposite to the this one is sorry this one the gallbladder round ligament is parallel to the gallbladder. Then gallbladder के opposite में we have this inferior vena cava का drainage, and then round ligament के opposite में we have the ligament venosum. Then you have this porta hepatis, in which we have the DVA system. So D meaning the common bile duct, then the portal vein, which receives the venous blood, and the hepatic artery, which receives the oxygenated blood. Now, through groove of porta hepatis, quadrate lobe and quadrate lobe. These are also now we have two lobes. The tail of the liver is known as the caudate process. So basically, the liver has two lobes, the quadrate lobe and the quadrate lobe. It's like one is here and one is here. Then, if I for the topography, for the skeletopy, midline of the base of the xiphoid process. For the holotopy, upper right part of the abdominal cavity situated in the right hypochondric region. And for the syntopy, fixed to diaphragm by two ligaments, the falciform and the coronary. The falciform divides the liver into right and left lobe. For the diagrams, so this is the right lobe, this is the left lobe, the one in the purple or pink is the falciparum ligament. Then here is the coronary ligament. Here will be the diaphragm. Now in this diagram you can see this is the gallbladder. Over here is the near to the or like nearby to the gallbladder you have the quadrate lobe, and opposite to that you have the caudate lobe. This one right here, see, you can see gallbladder, quadrate lobe, caudate lobe. This is the porta hepatis, and this is the bare area because here is where it is connected to the diaphragm, and then all these are the impressions, and this is the porta hepatis, and here is the ligamentum venosum. See, gallbladder, quadrate lobe, ligamentum venosum. Gallbladder, quadrate lobe, ligamentum venosum, and right here is the caudate lobe. I hope that helps. Thank you for watching. Please subscribe.